So looking at creatinine clearance and how we can use creatinine clearance to actually determine glomerular filtration rate. Okay. First of all, you guys should understand the two concepts. What is creatinine clearance? Creatinine is a substance from the body that is formed as a result of what? Muscle metabolism. All right. And glomerular filtrate rate is basically you trying to look at the rate of how this glomerulus is filtering out substances. And in this case, we are talking about creatinine. Okay, so looking at the rate at which glomerulus is filtering out creatinine is what we call what? Glomerulate glomerular what filtrate rate. So using creatinine to determine glomerular filtrate rate. Using creatinine filtration to check if your glomerulus is working properly or not. Okay, so that's just the concept of this lecture. So an overview of this lecture now. About 1 to 2% of muscle creatinine spontaneously muscle creatine spontaneously converts to what? Creatinine daily and is released into body fluids at a constant rate. Okay, so it is from the muscle. Okay, creatinine is from the muscle. So now it is a product of the muscle, so it is not needed in the body. So once it is secreted into body fluids, the body will try to what? Excrete it out because it's like a waste product of the body. Okay, so creatinine should be found always found in urine. So if you are having a high level of creatinine, it should always be excreted too. So if you're having high levels of creatinine in your body, then there's a problem. Do you understand? I remember when my brother had some kidney disease, always when we go to the hospital, they will always do a creatinine test. But as of that time, I was just going into my second year of medical school, so I was still on the anatomy stuffs. So I didn't really know why they were doing the creatinine test, right? But creatinine is a waste product of the body and should be excreted. So high levels of creatinine in the body or low levels of creatinine in the urine indicates that there's a problem, okay? So endogenous creatinine produced is proportional to muscle mass, okay? So it's dependent on how large the person is, the weight of the person too, okay? So it is the function of total muscle mass. Also, the production of creatinine varies with age and the sex of the individual. All right, dietary fluctuations of creatinine intake causes only what minor variations in daily creatinine excretion of the same person. All right, so dietary intake is not really a problem, okay, because creatinine is produced in the body itself. All right, so creatinine released into body fluids at a constant rate, and the plasma levels maintained within narrow limits because it's a waste product of the body. So normally the creatinine levels in the body are very low. So testing for creatinine levels and finding that okay that an individual has a high creatinine levels, then there's a problem. Okay, so it should be maintained within narrow limits. So creatinine clearance may be measured as an indicator of glomerular filtration rate. Okay, creatinine clearance may be measured as an indicator of glomerular filtration rate. Okay, how the amount of creatinine that is filtered here, okay, is to show how functional this glomerulus is. Okay, do you understand? That's why we say that using creatinine clearance as using it to actually determine for glomerular filtrate rate. Okay, so moving forward now, creatinine clearance and clinical utility. We say that the most frequently used clearance test is based on the measurement of creatinine. All right, it's a very common test. I come across it in the hospital. All right, so small quantity of creatinine is reabsorbed by the tubules, and other quantities are actively secreted by the renal tubules. So creatinine clearance is approximately what 7% greater than inulin clearance. Okay, so they always use creatinine instead of inulin. All right, so the difference is not significant when glomerular filtrate rate is normal, but when glomerular filtrate rate is low, let's say 10 milliliter per minute, tubular secretion makes the major contribution towards creatinine excretion, and the creatinine clearance significantly what overestimates the glomerular filtrate rate. Okay, so let me say really creatinine going back into the tubule is in low amount, okay, except in rare cases, because most of the creatinines you see in the urine were directly filtered from the glomerulus, okay. So just a small amount of creatinine is actually secreted or reabsorbed back into plasma. Do you understand? So most of the creatinine you see in urine is actually as a result of the work of the glomerulus, okay. So it is great indicator of if the glomerulus is functioning properly or not. All right. So guys, that's it about everything, and see you guys pretty soon.